Hello, Vetaheaders! How you doing? Dr. Proença here. Is my mic working? Yes, it is. Hello, Dr. Proença here with another Darlings. This is the every month. Hello! Every month I get here with you guys to share with you the products or services, equipments that I really enjoy using that makes a really good difference in my clinical life, in my routine, in my clinical practice. And I want you to know about them so it also makes a difference in your life. This is not sponsored. This is things that I actually use, that I actually like. Hey, hello everybody! How you guys doing? I'm gonna be sharing with you, hello Vetaheaders, I'm gonna be sharing with you something today that I use a lot in my practice. It makes a huge difference. I'm gonna be showing some details. And I love to know, what are you using in your practice? What is something you cannot live without? Oh, no sound. Really? Wait, is it my mic not working? Cami, do you hear? Do you have sound? It says to me here that is working. Camila, let me know if you can hear this. Hi, okay. Can someone let me know if you sing? Oh, for me it's okay, Cami says. Okay, good. Make sure it's not the volume on your cell phone. So I'll be showing bowling, it's good. Awesome. So guys, again, if you think you know someone that could benefit from learning or from sharing things that they like and they work with Zoomed or exotic animals, share the link of this live with them right now. And these lives now stay recorded because they didn't used to. So now you can either see them on Instagram or on our YouTube channel, but they were going to be here. Last month we talked about feeding tubes, and I know it's something really basic that a lot of people already know about. But remember, we have Vetaheaders that are just starting, and we have Vetaheaders that are really, really knowledgeable. And also, when we're sharing these things, we also share experience that we all have. So it's always useful no matter in what level you are. And today I'm going to be talking to you about something I use for anesthesia, and more specifically for anesthesia of reptiles. Well, some reptiles and birds, okay? This is what I'm gonna be sharing with you today, and I wanna know if you know what those are. Look at them. So cool. I have all sizes. So I love endotracheal tubes, but do you know what type of endotracheal tube this is and why I use it? So there you go. And why I use this one. Look. See, those are endotracheal tubes. They are called Cole tubes. C-O-L-E, Cole tubes. Look. So you see what's different about this tube? This is a big one. This is a size 6. Size 6. So this I'll be using on my car, for example. Woo, my light, sorry. And then here I have a size 4. And it goes all the way down to size 1.5. Super tiny. And I'm going to be sharing something with you today. So stick with me, because see how flimsy it is? I'm going to be showing you a trick to actually be able to put this in an animal, right? And not to tie it and not obstruct it, because it's really flimsy, see? So I'll be sharing, stay here, and I'll be sharing a trick with you. So again, they go all the way. I have a size 2 here, 3.5, 3. So the diameter changes. But what is the same in all of these Cole tubes is this. You see how they start, let me get the bigger one. They start at a diameter, and in here they become narrower, right? See that? Okay, that's what makes this tube really good. This is what makes this tube a Cole tube, exactly, a Cole endotracheal tube. So why is this good? Certain animals we work with, such as some lizards, chelonians, well, lizards, majority of them don't, but chelonians, birds, they have complete endotracheal rings. What does it mean? It means that the trachea, the cartilaginous ring, is complete, is a circle, versus in like mammals, and some reptiles such as snakes and majority of lizards, they have a C shape tracheal ring. So it's a C-shaped tracheal ring, and then the rest is smooth muscle, right? So it distends a bit. So much so that when we intubate these animals, mammals, snakes, and some lizards, when we intubate them, especially mammals, right? You guys are used to doing dog and cat surgery. When we intubate them, we then use a cuff, right? And the purpose of the cuff is to seal the airway, right? So we place the tube and we inflate the cuff so that way there's no air passing around the tube. Now, if you're working with a chelonis or a turtle or a tortoise, if you're working with a bird, remember they have complete tracheal rings. So you cannot inflate the cuff, because if you do, I don't know, my phone is doing these things. The hearts. I do want to send you hearts, but that was not intentional. I think I did this. I don't know, because of the C. Who knows? But what I was saying was, because they have a complete tracheal ring, if you do inflate the cuff, you're going to cause hypoxia. So basically, you're going to cause those tracheal rings to not receive blood, because the pressure of the cuff is going to make the circulation stop on those tracheal rings. So you're going to cause hypoxia to those rings, not to the animal. And then what's going to happen is, like 15 days, Livia, guys, my best friend in the entire world is here, Livia Larcão, yay! She's an attorney and a psychologist, so she's here just for moral support, I'm sure. And I love it. So as I was saying, those tracheal rings and the tracheal rings are gonna suffer with the lack of oxygen to them, not the animal, and within a few days or 2 weeks sometimes, depending on the species, those rings are gonna die, are gonna become necrotic, right? So we're gonna have a huge problem there. You don't want to do that. So you can't use cuffed tubes in animals that have a complete circulotracheal rings, right? You can't do that. So then how do we stop? How do we prevent, right? How do we prevent the air from going around the tube? Because there are problems with that, right? If the air is going around the tube, so say my tube is not a cold tube, it's like this. If the air is going around the tube because I don't have a cuff to seal that, right? That balloon, I cannot inflate the cuff, the air is gonna go around. That means that gas with anesthesia, with isoflurane and sevoflurane, is gonna now go around it. We all gonna be breathing that, which is not good, it's not healthy, right? It's a hazard. Also, it's a health hazard. Also, if the air is going around it, that means that my entitled CO2 readings are also gonna be off, right? So we wanna avoid those things or mitigate them, decrease them as much as we can. That's when we use cold tubes, okay? So for example, this cold tube is a 3.5. 3.5 is the diameter of the tip of the tube, okay? Of this part of the tube, 3.5, right? But you see how it starts 3.5 and then gets bigger, right? So the reason they are shaped like this is that the hope is that this part of the tube here acts like a cuff. So what is the idea? Okay, let's assume that this is my trachea. This is the trachea of the animal. Let's assume that. And remember, we're talking here about animals that have complete tracheal rings. The cartilage of the tracheal ring is completely circular, like this. So let's say this is my trachea. Now, if I intubate using this, and it's a cold tube, I'm gonna introduce all the way in the trachea, and then this part here that is a little bigger, larger, is gonna stop at the glottis, right? Or the beginning of the trachea, the rostral aspect of the trachea. So because it's a little larger, it will partially, or because it's not a complete seal, but it will try to seal it so the air doesn't go around it. Can you see it? So again, it will act as a cuff without being a cuff and without inflating it, right? Without causing any type of necrosis of the tracheal rings, without causing any type of hypoxia to the rings. And hopefully, because it has this part that is a little bit larger, right? It will also prevent any air from going around the trachea and coming for you. For example, you're not going to be breathing ISO. But the very important thing is for that to work, and remember, it's not a complete seal, right? Because you can't inflate it. This is the size it is. But for this to work, you need to introduce all of these inside of the trachea. Because if you only put this much inside of the trachea, you will still not using this tube properly, and you're still not going to have a seal. So sometimes we will have to, depending on the size of the animal, right, we will have to sometimes shorten this part here, because you don't want to. Flo, how you doing, my friend? Hello, Flo. Hopefully I'll get to meet you in person at Eye Care this year. Flo is a great veterinarian, guys. Follow him on Instagram. Flo, today we are talking to our friends about cold tubes and how they are so useful for some reptiles such as chelonians as well as birds, because they have complete tracheal rings. Okay, guys, so as I was saying, for this to work, for the cold tube to work, you need to introduce this entire part inside of the trachea. And this might be too long sometimes, so you need to make sure you shorten it, okay? So that's why they're so useful. Now, you still have to have all the sizes, like I told you. And here I have all the sizes that I use. I usually don't see any animals that require something bigger than this. And if they do, usually what I do, I will use a regular tube, but I will not inflate the cuff. Okay, so here I have like all sizes. Look how cool. Those are called cold tubes. Now let's talk about how to maintain them, pricing, etc. The first thing I want to tell you, they are reusable, so you can definitely disinfect them and sterilize them. But when you go to sterilize them, this cannot be put in your autoclave. It needs to be gas sterilization, or otherwise they're gonna melt, okay? And of course, we should be disinfecting them in between uses. Now, one thing that I wanna tell you is, we have as small as, for example, this 1.5. Actually goes, they size 1. I don't use the size 1 as often, so I don't have it. So I have this 1.5. Well, this 1.5 comes with this stylet here. See, it's a very flimsy little piece of metal. I don't use it. It's worthless. It's useless. Okay. So, but you see how flimsy it is. Okay. What I use here is I use a dental wire to put inside. I don't have one right now to show you, but I use dental wire as the stylet because that other stylet that I just threw it is too flimsy as well. It doesn't help me. And then for the bigger tubes, I will use my metal stylet that I usually use. The important thing for you guys to know, when you're using a dental wire as a stylet, the tip of it is not blunt. You see how this is a stylet, a regular stylet, but you see how it's blunt at the tip, and the reason is to make sure I don't perforate the trachea. So if you are using a dental stylet and a stylet for this, which often you will have to, why? Because this one, it will not fit in here. See, this is bigger than the diameter of the tube. That's why I use a dental stylet. You need to make sure your dental stylet is not protruding from the tip of the tube, right? It's slightly shorter than the tube itself, so you don't have the risk to perforate the trachea. So for example, well, once they start becoming bigger, they are really more rigid. You might not need this, but for example, in this case, I could put this one here, and if it does pass a little bit, it's not a problem because it's blunt, right? But for your dental wire, it's not gonna be like that. So you wanna make sure it's always a little shorter, okay? The other thing you wanna do too is lubricate these tubes. They tend to be the silicone that's a little bit more sticky, so you need to lubricate this part when you go to introduce in the trachea, okay? Now, these tubes, as I was telling you, especially this flimsy one, one, you do need a stylet to place it. I use this one, for example, for rats, sugar gliders. Let me tell you this. I just told you that in mammals you can use a cuff, right? And it's true, but they don't manufacture a tube with a cuff that is this small. So that's why I ended up using them. Not so much because of the cold tube part of it, but because they are smaller. So yeah, I definitely need a stylet, especially if I'm intubating a rat. You're not gonna be able to intubate with a flimsy like this. That's why I use the dental wire. But then you're gonna also have another problem, which is when you go to tie this, right, to secure it on the animal, on the patient, if you use regular ties, it's so soft that you're gonna occlude it. Let me see if you can see it. It's so soft that you really tie it, it's gonna obstruct it, okay? And then the air is not gonna go through, and then you're gonna have problems. So what I like to use, and I have shown you guys this in another Darlings, I use these endotracheal tube ties. Okay, let me show you here. I'm just untying it. I'm untying the tie. I like to use these endotracheal tube ties. I like this for many reasons. I'm not going to go a whole review of this because we already have it on the Darlings, but it's a silicone type and it does not obstruct the tube. So again, you will just do like regularly you do, okay? And you will tie it, right? And then this part goes on the animal around the head. I also like it because it's bright red, so I don't forget. Now, another thing that I use Scooby-Doo's. I don't know what that is. What is a Scooby-Doo? And what I also do, sometimes I will use tape, medical tape, okay? I tape it instead of tying, and then I use the tape here. The tape goes here, and then on this side, I fold the tape onto the tape so it's not sticky anymore, and then I use it as a tie around the head of the animal. Some people will use this rubbers to do it. These also will obstruct this tube, okay? Now, obviously, if you're working with bigger tubes, you're not gonna have this problem, such as this one. You're not gonna have this problem, okay? Now, these tubes here in the US, they cost about $17. It depends on the size. Some might cost $20. And we do need to have all sizes, obviously, because of the different size of animals. This brand, there are different brands. Some of them will come in blue. Some of them, you know, I've seen orange ones. They're different brands. This is not sponsored, okay? And I'm not endorsing any brands here. I'm just letting you know where I bought it so it's easy for you. This one is from Jorvet. See? Jorvet. Another thing that I will say, a lot of the brands of these tubes, they don't come with the size here. See how this one says 6 millimeters internal diameter? Remember, it's 6 millimeters internal diameter here. It is internal diameter, not external, meaning this tube, it's like 6.2 or 6.3 millimeters diameter. The internal diameter is 6, okay? So some of the brands don't come with this, like they're totally just, there's nothing written on them. So it's only on the packaging. And I know this might sound super simple and basic, but believe me, it happens more often than not. If you do not, see how I write with permanent marker here, the size of the tube? Because if you don't, the size is only on the packaging, and then later you don't know what size this is. I also have the habit of doing this anyway. You see mine has written here, but I also write here just in case, because with time, when you use it multiple times, it can start erasing the number. So I definitely like to write it here. So again, guys, today we're talking about the cold tubes, which are these endotracheal tubes that are used for animals that have complete cartilaginous endotracheal rings that we cannot use cuffs for. And Santana, how are you doing? So long since I saw you last. And so the cold tubes are used to work as a cuff as much as possible. Of course, it's not going to be a perfect seal, but for that to work, you need to introduce this entirety, like this part here, it needs to go, the whole thing needs to go into the trachea. I've seen people using this where they only put a little bit in the trachea. That's not gonna do the trick, okay, guys? If this larger part is not touching the glottis or the trachea, it's not gonna seal. So, but you say, but Dr. Proença, if this is too long to go into the trachea, that can happen in some cases, in which case you need to shorten it. You need to cut it and make it shorter, okay? So those, I really like to use those. Those I will say is a must-have if you're working with turtles and tortoises. If you're working with birds, this is a must-have. This is a must-have. And I use them very often. And as I was just showing in another darlings, I was showing this to the ties, right, for the endotracheal tubes that I really like. That's like kind of a silicone. I really like it. I use this for any endotracheal tube, to tie any endotracheal tube. So I use it and always have a stylet, which will really help you place any tube really, but especially these smaller ones, right? The tiniest ones, they're very flimsy. Those are gonna be your best friends. And always remember, guys, during anesthesia if say your patient starts having hypercapnia, which is increased entitled CO2, make sure to, especially if you're using the small ones, make sure to see if they're still patent, okay? Make sure, because sometimes, even if that's an important thing. Okay, this is very important. I want to share this with you. Are you guys with me? Okay. Even if you use the appropriate tie and the tie, it's not obstructing it. If the animal like moves and bends the neck, it will do this. It will kink it. See how it's kinked already? So the air will not flow. And then you start having problems, obviously, right? So you need to make sure you always keeping the head of the animal very straight, neck very straight, and nothing is making this tube kink. Okay, see how easy it is to kink? Okay, so I always keep it very straight. One way you can do it, you can put this, you can either, here in the United States, syringes come inside of a cover, a plastic cover. So I will use that plastic cover. I will put the plastic cover right here. Okay, and I'll put this inside, so that keeps my tube straight. Or you can even cut a syringe and use that to put it here to keep it straight. Okay, also like any other small tube, you need to make sure it doesn't become obstructed with saliva or any fluids, right? So you always need to make sure this part didn't get, and that goes for any small tube, not just for cold tubes. Do you guys use this? Let me know if you guys already use these tubes and if you like them, and also if you use something cool that you want to share during the anesthesia of your birds and reptiles. Again, not all reptiles have complete tracheal rings. Majority of snakes and lizards do not have complete tracheal rings. They have C-shaped rings, especially snakes. Remember, how is a snake gonna eat, right? If they have complete tracheal rings that will not collapse during eating, that will be a problem, right? If they're eating a prey. But again, tortoise, turtles, and birds, they all have complete tracheal rings, and we cannot use cuffs. We cannot inflate cuffs because that's going to cause necrosis of those tracheal rings, and we don't want that, right? Okay, so let me know if you guys are already using this in the comments. This video is going to stay on our YouTube channel. Have you guys seen our YouTube channel? The Vetahead on YouTube. We're posting a lot of videos there, and our webinars that did not used to stay for you guys. Once it happened, it would disappear, but now they always stay in our YouTube channel. So you can go there, you have the other darlings there, and you can go there and rewatch. And as I was telling you, you can even see the darlings that I talk about this. I say the name of the company, I show the website, I talk about the price, and all of that is in the other darlings. Okay, guys? Well, Thank you so much for being here. We're gonna be back next month where I'm gonna share another either service or equipment with you that I use that really makes my life easier as a clinician, and that I really like. Remember, this is not sponsored. I am not endorsing anything. I'm just merely showing you an equipment or a product or a service that I really like to use, okay? Thank you guys very much. Camila, thank you very much. Camila is our social media manager. She does an amazing job. Thank you so much for being with us. Cipollina, hi. Thank you. Thank you for being here. Thank you so much. And I will see you guys in the next one. Bye-bye.